if you were given a grant, Lee, for $1 billion to
Okay.
meet the needs that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
Yeah, it was an interesting question when you sent it ahead of time. I really kind of thought about it because I had all these different ideas. And I think there's two places that I mostly landed on. The first would be the idea of, health starts at home, and it starts with nutrition, and it starts with access to your best opportunity to be healthy. And I see this places where my kids spend time, and they go to a fantastic magnet school, and there's a lot of socioeconomic diversity there. And there are people who really, truly, they don't have access to fresh fruit, and they don't have places to run around as kids and, get exercise and be surrounded by trees and all of that. And I mean, the evidence is so abundantly clear that your zip code determines your health outcome, right? And so there have been some states that have done some really innovative things and allowed Medicaid to pay for prescriptive, boxes of produce, or to pay for kids to be involved in sports leagues when otherwise they wouldn't, things like that. So that's an area that I'm definitely interested in. I'm passionate about. The other would be I would love to see, and this is such a challenge, it's not for lack of trying, but more research and support for dementia care and Alzheimer's and other dementias. It's the fastest growing chronic disease in the country because we have an aging population and people are living longer, and more and more and more people are expected to be diagnosed with some form of dementia. And it's not only their experience, but it's also the caregiver experience. My mother passed from dementia, and I know what that experience was like, and people aren't ready for it. This country is not ready for it. We don't have enough memory centers, care center, residential for people with dementia.